Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life in Balance, as well as the author of Migraines and Epilepsy, How to Find Relief, Live Well, and Protect Your Brain. So, talking about epilepsy in this particular video, and trying to identify where the disconnect is between the information that patients are getting and what actually happens with them. And there are a couple things that are like, not a no-brainer, but a absolute that needs to come with anybody who's having seizures or epilepsy. And the two things that are on top of the list is, well, stress would be high on the list too, but you can't just change that overnight. But physical activity and vitamin D, both of those have consistently shown to be helpful with both seizures and anything to do with the brain. It's very important. Unfortunately, a lot of anti-epileptic drugs actually lower vitamin D levels and have a tendency to be bad for bone health. So that just makes the vitamin D that much more important. But this all drives back to a recent study looking at exercise and overall quality of life with patients with epilepsy. And they looked at 113 people with epilepsy, and they found that 84% of them were considered sedentary. It means a very small percentage of people with seizures are exercising, despite the fact that it is very clear that exercise is good for the brain and has its own inherent anti-seizure benefit. So I know sometimes there's a challenge because depression coexists and anxiety, and some of the anti-seizure medications just produce fatigue or just desire to not move. It's something that just absolutely has to be on the list of important things to do. One of the things that we found was the people who were more active had a higher quality of life and lower rates of anxiety and depression, which ends up making the seizures worse. So if you are in one of the 16%, then go ahead and pat yourself in the back, because you're doing more for your brain than the 84% who are sedentary. And if you are in the 84%, then what's keeping you from exercising? And did your either neurologist, primary care doctor, neurologist, or epileptologist stress to you how important it is to stay active for just a variety of reasons, but just overall for brain health? So just trying to figure out where the disconnect is, because clearly there is one. There's no reason that 84% of people with seizures should not be exercising when it is so critically important for their brain. As always, I'll post the link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.